You're watching CTOM TV. Knowledge is power.
Now we have a question from Joanne, who's with us today. And she's saying, if you've been diagnosed with stage 4 triple negative breast cancer, would you still suggest to have a PET-CT scan and liquid biopsy done?
Oh, most definitely, yes. The first thing I would do, as with any cancer, but especially with triple negative, is make sure you get tumor DNA sequencing.
Right.
There's so many subcategories of triple negative. There's androgen dependent, there's basal, there's triple negatives with slight estrogen, with slight HER2. There's so many different subtypes and variations, mesenchymal, stem cell-like.
And I know on top of, okay, so let's just recap what you were saying. There's so many different types
Of triple
or
negative.
subtypes
Of triple negative, yes.
that without proper tumor DNA testing, you're not going to be able to know what mutations are driving your cancer. So that's where you're going.
Exactly.
I know that increasingly, because we've all heard of, breast cancer is a big deal, and BRCA1 and BRCA2.
Yeah.
I know that we've had a number of instances ourselves, with clients coming to us, getting the testing done, where before coming to us and having the kind of standard public healthcare testing for these genes, have been told that they didn't have those mutations.
That's because they didn't look at the tumor. They looked at the inherited versions of those genes,
okay,
which is not entirely relevant.
Right.
I mean, it's relevant, of course, because it's related to your family. But as far as treatment goes, somatic mutations are really what we want to know about.
Okay, and somatic mutations means stuff that's in your tumor tissue or kind of
tumor, independent.
Right. So if your doctor has arranged for you to have one of those kind of BRCA1 or BRCA2 tests, that doesn't mean conclusively that you do or don't have that mutation, and you certainly have not then looked at all the possible mutations that could be driving your cancer. And there's some big differences that you're able to make for people when you're able to understand those subtypes more clearly. Certain treatments that would be otherwise part of standard medical care for breast cancer would be really not a good idea for certain people, or not as beneficial.
Yes, definitely.
Yeah. Okay, so Joanna, I guess the answer is, if you haven't had tissue biopsy tested yet, that would be the place to start. Then you know you're getting the right treatment for sure. And then from there, yes, the PET-CT and the liquid biopsies for monitoring, but you need to know what it is you're targeting in order to use those liquid biopsies for monitoring is the plan.
Thank you for watching CTOM TV. Subscribe below and stay informed.